What is Lupron used for in your IVF cycle? So Lupron can be used either as a trigger or in combination with HCG as your trigger. In that instance, Lupron is LH, so it's increasing your LH levels and triggering ovulation. Now, Lupron can also be used as part of your stimulation cycle. So if you're not doing a typical antagonist cycle, there are protocols that instead of that antagonist, instead of the ganirelix or cetrotide, they're using microdose Lupron, so in some very small doses. They're using it to actually assist with stimulation. And the way that Lupron works is that it can suppress your system. And so again, we're suppressing everything else, all the outside noise, so that the FSH and the LH can work better, essentially. What is Depo-Lupron used for? So Depo-Lupron was traditionally used as a method of birth control. So what it does is that it suppresses your system. It shuts everything off. The way that we use Depo-Lupron for IVF, and it can be used either for the egg retrieval procedure or leading up to an embryo transfer, is that when it does suppress your system, we have a better chance of hijacking and controlling your system. So we kind of want to shut everything off when we use Lupron. And so it can be used both for birth control if someone is using it for that purpose, or in IVF for either egg retrieval or embryo transfer in order to give us more control of your system. How many days do you take Lupron for? If you're using Lupron during your stimulation cycle, it's typically started in the beginning of your cycle in conjunction with your other medication. So some protocols will have you take an initial dose of the Lupron the first night, and then starting the next day, it's taken in conjunction with your medications. And if you're using it, Lupron for a trigger, it's just done during your trigger shot time. Some clinics will have you do, if Lupron is part of your trigger, 2 separate specific times for it. How is Lupron administered? So Depo-Lupron is typically done intramuscularly. So if you're using Depo-Lupron leading up to an embryo transfer or using it as birth control, it's typically injected intramuscularly into the arm. Some doses have to be injected or are recommended to be injected intramuscularly in the buttocks. But if you're using the microdose Lupron as part of your stimulation cycle, as part of the egg retrieval process, or if you're using it for the trigger for your egg retrieval stimulation process, that will be done subcutaneously in the fatty tissue, typically in your abdomen. Are there any side effects to your Lupron medication? Yes. Lupron tends to be the medication that we hear more side effects from. People generally do not like being on Lupron. The microdose, the small amount that we use for stimulation for an egg retrieval, we don't hear that much about, but certainly things like Depo-Lupron, we hear much more side effects. We hear people reporting hot flashes and more symptoms that are associated with if somebody's having typical PMS symptoms when they're getting their period. But hot flashes is a big one associated with Lupron.